Hi YouTube, it's Courtney, or VSG Redesign Me. I'm coming at you with my 2-week post-op update from vertical sleeve gastrectomy surgery. I had my surgery on January 7th with Dr. Sommer at Hudson Valley Hospital Center. My starting weight was 345, and my weight last week was 317.6, and my weight this week is 315.6 for a total loss of 2 pounds this week. So that was a long and hard fought 2 pounds. At some point I lost 3 and now I'm back up down to 2, and I just keep fluctuating around 315. I briefly saw 314 and then it went back up to 315, and I've just been struggling with it. So let's talk a little bit about everything and how it's going and whatnot. Back to normal, back to work. I'm on mushies. Everything went fine with my post-op appointment, which I think I talked about in my last video. I feel pretty good. My heart rate's back to normal. I'm going to the gym. And yeah, so my relationship with food is fine. I haven't had any like freakouts or anything. I know a lot of people are having problems with restriction. I've actually found the opposite to be true. My sleeve likes pretty much everything and I can get down a lot. I came home from the gym last night and I was hungry, and I had 2 eggs and 2 pieces of bacon. That was too much, but honestly, if I had had just half a piece of bacon left, I probably would have been able to get through it just fine. My diet's pretty straightforward. I either have a shake in the morning or like a cheese stick or something, and then when I get to work, I'll have lunch, which this week was Trader Joe's meatloaf, which was really good. And then for dinner, I either have whatever we're making or some eggs and bacon or something. It really honestly depends on how I'm feeling. Every once in a while, I'll have a snack of like really soft perky jerky or a Baby Bell or string cheese or yogurt. But for the most part, that's about it. I'm sitting at around 500 to 640 calories a day. I'm struggling with my fluids, not because I can't get them in, just because with eating and everything, it's a really big struggle because you have to wait the half hour after you eat, and it just screws everything up. So I get around 50 ounces at the very least in, and if I'm trying, I can get 64 in. My goal is to get up to 100 eventually, but gung-ho. So that's it with food. Everything has been tolerated really well. Excuse me. I'm very tired. I have no complaints so far about my sleeve, other than maybe it's a little too generous with me. I wrote down everything today and I was like, okay, well, I did have a 2-pound loss, so maybe I'm just freaking out. It just feels like surgery was so long ago, and I guess, like, right now I just feel like I should have lost more weight, but yeah, so I've been struggling with that. But hopefully next week, I just want to be out of the 3 teens, honestly. I just want to be done with 300, and I'm just getting antsy with that. What else? So working out at least 3 times a week, I'm trying. Not doing anything crazy at the gym. I'm going and riding the bike. There's this thing called the New Step, which is kind of like a sit-down elliptical. I tried the elliptical. I wrecked my quads and they killed me for 2 days, so I'm not ready for the elliptical. After my knee surgeries and stuff, I wasn't really sure if I could even do it. I tried 3 minutes in and I wanted to kill myself, so maybe not. Our gym did just get really cool Life Fitness recumbent bikes that you can actually like Tour France and stuff on your bike, so that's pretty cool. We did that the other night. I did like 3.25 miles. I had done more the night before on Wednesday, but with the quad pain, I was like, I didn't want to push it. But for that, I used Tiger Balm. and I took 2 Tylenol, which went down fine, and I woke up this morning and I felt good, so, just getting back into the swing of things. My post-op appointment has been moved until, after I get back from the conference. I guess my doctor's on vacation, and so I have to call them the week before the conference and see if they'll move me to regular food. Maybe not. I don't know. I've been struggling, and this is TMI, so for the next 2 minutes, if you don't want to hear about it, shut it off. But this is the truth, and it is part of the journey, or whatever the fuck it is that we're on. I've been struggling with potty issues. I say potty issues, but I never use the word potty, so I've been struggling with the issue of crapping. I pretty much knew it was going to happen with the colitis that I had had previously, and my body hates narcotics and anesthesia and a whole slew of things. But I went like a week without pooping, and I'm pretty sure that's where most of the weight is holding on, but now I'm not so sure because I've had like the opposite issue of constipation yesterday, and I've started taking probiotics, and I'm not really sure what's going on anymore, so I'm going every day, but it's like a tiny, tiny, tiny amount, and I don't like, but it's not like hard. I don't know. It's weird. It's really weird. So I'm struggling with that and wondering what's going on with that. I noticed my fat percentage went down 3% on my scale. I'm not convinced that it's all fat, but maybe it is. Maybe the reason why I haven't lost as much weight as I'd hoped this week was because I've been building muscle. I don't know. I mean, I'm not a doctor. Who the hell am I to say? But yeah, so that's that. What else? I bought my ticket for Obesity Help conference in October, so I will definitely be going to that. I used to live in North Carolina. My actual 10-year high school reunion's the weekend before that in Wilmington, but I'm not going to be able to do both, I don't think. So I would rather hang out with weight loss surgery patients than people I didn't really like. So there's that. So I'm going to come down and talk to Amy about possibly sharing a room because Tara can't go. Because she has a wedding in Georgia to go to that I will not be going to. Yeah, so I'm really excited about that. I'm excited about WLSFA in April. Everything's booked for that, so we're definitely heading out. Tara will be there for that. I'm so tired. The reason why I'm tired is because I just had a whole bunch of work done on my back piece for my tattoo. And that takes a lot of energy out of me. It's just stressful and on my body. And 2 weeks post-op, I wasn't even really sure if I was going to be able to do it, but it went well, like in terms of pain and like laying on my stomach for 2 hours. But I'm tired now and I'm sore from it. But it's really pretty. If you're not a friend of mine on Facebook or Instagram, then go do that and you can see it. I love it. My tattoo artist is amazing. But that's not WLS, so let's talk about something else. I never really did my follow-up video for the hospital, and I don't think I'm going to be doing that tonight either. Maybe I'll get to it tomorrow. Honestly, things have just been crazy. And with commuting back and forth and going to the gym, I'm not getting home until like 8:30 at night. And honestly, I'm just tired. So, there's that. Ugh. I have graduated from the sippy cup. The noise was annoying me, and I can drink more than just the sippy cup fluid amount, so I moved up in the world. Yay for me. I feel like I'm rambling this. I really didn't have much to report this week other than my frustrations with the yo-yoing. Next week is a better week. I am officially out of size 26 pants, even though I'm still using my size 26 pants. I have a 22 and a 24 that fit me. I had a really funny experience with Old Navy because I can fit into their 3X plus size compression pants. And I can also fit into their XXL regular size compression pants. So I don't know what size I am. Yeah. This is the life. All my bras are loose on me. Even the bras that didn't fit me a month ago don't fit me now. Inches, I did do measurements. I usually do them on Sunday, so you're going to get last week's measurements. Sorry. I'm all fucked up this week. But I have lost a total of 14 3/4 inches since surgery. So that is not a bad statistic. And 30 pounds flat, I can't get beyond 30 pounds. I have lost 4.7 points on my BMI though. I was 54 when I started and I'm now 49.3, so I'm now officially out of the 50s, which is to say something. So, in 25 days, 14 3/4 inches lost. I'm not going to argue with that. A lot of it was off of my waist and off of my hips. And my thighs. I lost like 2 inches on each thigh last week. That was crazy. So, I'm feeling good about the inches. I just wish the pounds would catch up. But I know I'm only 2 weeks out and I've got a very long journey and miles to go before I sleep. So, I hope everybody else is going really well. I hope everybody's losing weight and getting their protein in. I'm not going to do shout outs tonight. I'm sorry, guys. I'm really behind on videos. Life is just catching up. The conference is in a few weeks. Kind of makes things crazy for me. So, thank you for all your support again on Facebook. It's been great and helpful. And I did make an account on Instagram, so if you want to follow me there, I'm VSG Redesign me there too. So hopefully I'll pop on tomorrow and do my post-op surgery video. Yeah. I think it's like past the point of no return with that, but we'll see. So, yeah, have a good night. Bye.